All right, good afternoon and good evening, everyone. Thank you so much for joining us. I want to recognize that we do have folks from around the country on this webinar tonight because this was promoted via the AARP Virtual Community Center. So welcome to all of you. My name is Kelly Leffler. I am a Senior Program Specialist with AARP Massachusetts. And the event that you are attending tonight is called Essentials of Caregiving, really about making your caregiving plan, whether you are giving care or providing care. You'll hear a little bit more about that tonight. And tonight's event is also part of a fall caregiving series that is being hosted by AARP Massachusetts, and these are all virtual events. So even if you're not from Massachusetts, you can join us for some of these upcoming events. I am going to put a link. It's a very long link in the chat, but you can also find it in the future at aarp.org/2022 caregiving. I'm going to put that in the chat as well. One last final item, if you are in the Massachusetts area, we are actually hosting a wonderful event this Saturday in Worcester at Bull Mansion, again in Worcester, and we are going to be having a comedy night hosted by comedian Jesus Trejo. He has created a documentary with AARP Studios called Care to Laugh about his own caregiving journey with his parents. So he will be joining us in person in Worcester this Saturday at 7 p.m. at Bull Mansion for an intimate night of comedy and also some thoughtful conversation around caregiving. So if you're in the area, please take a look at the link that I just put in the chat there. So I am about to hand it over to your presenter for tonight, Teresa Chaklos, who has her own experiences with caregiving, which you'll hear a lot more about today. If you have any questions as Teresa is speaking, please feel free to put them in the Q&A. And she's going to be talking about a lot of different resources, and you will all receive those resources as well as a recording of tonight's presentation via email later on tonight. So with that, I am going to hand it over to Teresa and I will share the presentation.
Thanks, Kelly. Hi, everybody. Thanks for showing up this evening at dinner time. I hope either you've already had dinner or you're going to have a great late dinner. My name is Teresa Chaklos and I'm a volunteer with AARP. So I'm happy to be here with all of you today. This presentation you're going to see is all about supporting one another. And I invite you to share ideas, ask questions via the Q&A, and connect with other caregivers and care receivers, people just like you. And before we begin, there's a couple of ground rules here. Please try to save your questions until the end of the presentation, and feel free to grab a pencil and paper and write them down as we go along so you don't forget anything. And I'll do my best to try to answer all of your questions. Also, keep what is shared in the questions and tips as they're asked confidential. And just also remember, this is a judgment-free zone. So when it comes to caring for a loved one or recognizing that we ourselves might need care, most of us don't have a plan until a problem or a crisis emerges. People can now expect to live 20 to 30 years beyond the traditional retirement age of 65. Now, more than ever, it's important to prepare for the future so you can be prepared for and or meet the demands of caregiving. Next slide. So during this session, we're going to share a framework to help you make plans about caring for family members, neighbors, friends, and yourself. And it's my hope that after this presentation, all of you will feel comfortable enough to connect with others, exchange tips and advice, and explore available care resources. Now, I'm not currently a caregiver, but I had to quickly develop a team to help me when I was diagnosed with breast cancer and facing not only surgery, but aggressive chemotherapy treatment for 5 months. Through that experience, I developed a unique perspective which connects with the practicality and the difficulty in allowing others to help and take over certain tasks. At the time, I lived alone, I worked full-time, and needless to say, I thought I was quite independent. It was tough to admit that I was going to need help. And as it turns out, I needed help more than once because I had to undergo spinal surgery less than a year after completing chemotherapy. Next slide. To help you get a picture of today's caregiver, let's go through this slide. If any of the following is true for you now or in the past, please say yes in the Q&A. Have you ever helped someone with household tasks such as cleaning, laundry, or yard work? Or helped someone with medications? Provided food to another? Drove to doctor's appointments or made shopping trips or run other errands? Provided personal care such as bathing or dressing, or helped with finances or paying bills? I did not see anything in the Q&A, so I guess, oh wait, here we go. We got a couple of people responding, yes, yes, and yes, and another yes. So you get it. Caregivers are all of us. Next slide. So today we're going to go through some practical information to help you as you seek or begin to provide care while also best caring for yourself. And so regarding this quote you see on the screen, you know, it reminds me that when we give to others, especially our time and talent, it fulfills in us our own need to be needed and useful. And that's a great feeling indeed. Next slide. So we're going to break this down into 5 steps: starting the conversation, forming a team, making a plan, finding support, and caring for yourself. Next slide. Often, we avoid discussions about the future simply because we don't want to think about changes in our lives or the lives of the people we love the most. We wait until a crisis occurs before talking about our values and preferences, wishes for healthcare, or details about finances. It's never easy to bring up what you think will be an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk before a crisis occurs. It's easy to put off these conversations because they can be difficult, and we're busy. But you may be surprised to find out that your loved one has been meaning to have the talk also. Next slide. Before you start the conversation, here are a couple things to consider. Looking for an opening. And so when raising the topic of future care, you might find it helpful to reference an article you just read or something you saw in the news to break the ice. For example, you could say something like, I just read an article about gathering all your important papers. Sometime, can you show me where your important papers are and what you'd like to be done just in case? Respect your loved one's wishes and size up the situation by trying not to anticipate what they might say or how they might react. Just get the conversation started. Be open, express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time. Next slide. Money can be a particularly sensitive subject to talk about, but it's often at the heart of many decisions you'll make. Housing costs, healthcare, and other expenses such as groceries, medications, and transportation are some of the financial pieces to consider. Ask your loved one to review their bank accounts, investments, insurance coverage, and other relevant finances, assets, or income that can be used to cover these costs. Find out whether they have long-term care insurance should they need it. Next slide. Now, you may find that your loved one's initial response to your attempt to start the conversation is something like, I just don't want to talk about it. Keep in mind that some people are private by nature, and sometimes it's difficult for someone to admit they need help, and as a result, you may encounter some resistance. For those of us seeking help, know that our loved ones may have a hard time accepting that we are reaching the point of needing help, especially in situations where we're still working full time. If your first conversation doesn't go well, try again. If you're still running into difficulty, try asking a trusted family friend, doctor, or faith leader to share your concerns. Next slide. So now we're at step 2, forming your team. Now take a close look at the picture that you see here. It's clear that the discussion might include multiple generations, such as our children, grandchildren, as well as a spouse or partner. Next slide. So it seems a no-brainer to look for team members who live nearby. Proximity does have its advantages, such as the ability to stop over, drive to a doctor's appointment, or cooking a meal. But let's not forget that just because someone doesn't live nearby or have huge blocks of free time doesn't mean they can't pitch in. Family or friends living at a distance can help with tasks such as coordinating meals, bill paying, or financial assistance, especially those who are technologically talented. Don't be hesitant to ask others for help, even with what you might think is a simple task. Some people may only need a little encouragement to take on a simple task, and they're glad to do so when you ask. Next slide. In building and supporting your team, determine the number of team members. Now, both quantity and quality are important to think about when building your team. While having a large caregiving team can be helpful, the old saying, too many cooks spoil the broth, comes to mind. So make sure everyone on the team is clear about their responsibilities. They should be supportive and willing to lend a hand. Now, in assigning roles and responsibilities, remember everyone has something to contribute. So play to each person's strengths and be clear on what's needed and expected. Focusing on the care recipient is important for those of us who are seeking care, because the key and often overlooked participant in the conversation is the person who needs the care. So for those of us seeking care, barring mental or physical incapacity or another extraordinary circumstance, you're able to play a significant role in determining who should be on the team and what needs to be done. This is the time to put your needs first. Next slide. Now, making a plan doesn't have to be extensive or fancy, as you can never anticipate every detail or scenario. The plan should include immediate needs as well as plans for the future. In my situation, I made a chart of what type of help I thought I would need, such as rides to appointments, grocery shopping, house cleaning, and I emailed it to everyone who said to me upon learning about my diagnosis, if you need anything, let me know. This enabled what became members of Terry's team to schedule themselves at a time convenient for them and to complete a task they were comfortable with and able to complete. I learned that we often have the feeling that we wish we could help when we learn that a friend, a colleague, or neighbor needs care, but we get stuck in trying to figure out how we can help. The folks who helped me actually thanked me for letting them know specific ways they could help and for allowing them to help. So in formulating any questions or comments for later, please consider what might you do or differently or add in forming a plan. Next slide. So no matter where you are in the journey of caregiving or care receiving, just beginning to anticipate a need or helping to coordinate a big move or taking care of someone full time, having a good framework to help guide both you and your loved one will make the process easier. So now that you have a team filled with willing caregivers, it's time to start building out a plan and designating responsibilities. Always make sure your plans are being made with the person you're caring for at the center of the discussion. So hold a team meeting. This is one way to help get things organized and ensure that the team members are on the same page when it comes to making and sticking to the plan. If necessary, use your computer and phone savvy friends to assist you with setting up the meeting. So the meeting might take place face to face, over a conference call, Zoom, or through a series of emails. Determine what works best for most of you. Then assess the goals and needs. Assess the goals and needs of your of your caregiving plan. And remember, it doesn't have to be extensive or fancy, and you can't anticipate every detail or scenario. Just try to include immediate needs and broader plans for the future. After you determine your goals, delegate responsibilities. It's time to figure out who will do what. Next slide. Some additional tips include the person who will receive the care should play a significant role in talking about and assigning roles and tasks to the extent possible. For example, even if one team member is an accountant, the person who will receive the care may feel more comfortable having someone else look after their financial affairs. Communicate. Try to keep everyone informed as things change and make sure that everyone knows about the discussion ahead of time so there are no surprises or hurt feelings. Remember, continued communication is a key element throughout the caregiving and care receiving process. At one point, I had 5 pints of Ben & Jerry's Tonight Dough ice cream in my freezer because my team members knew it was a favorite of mine, but didn't realize how many others were also purchasing it. Thank goodness I had room in the freezer. And I would also start receiving texts from helpers who just happened to be at Target or Chick-fil-A or Whole Foods Market wanting to know if I needed anything. The problem was they knew that within the first week of my chemo, I dropped 15 pounds. I wasn't eating, I wasn't drinking enough, and they were concerned. So they would try to, kind of entice me with my favorites like, chicken nuggets from Chick-fil-A or snacks from Target and things like that. But the other issue was that sometimes I was just resting and then my phone would keep beeping with all these messages. So those of us needing care should let our caregivers know when we're having a good day or a bad day, and this will help the caregiver in determining whether or not they should reach out or just let you rest. Make sure you determine what tasks everyone is comfortable performing. Also, be sure to ask your team members about their preferences. It was surprising how many people were willing to come to my home and vacuum and clean my house when they themselves had hired help cleaning their own homes. One team member should take notes and write a brief summary of what was decided. A written summary of the plan helps ensure that the wishes and needs of who you will provide care for have been considered and included. What I did was once the chart I had sent out to the willing helpers was completed, I emailed the final chart to all of them so that each knew there was someone helping me on a given day. Next slide. If you've come to realize that the scope of care needed is beyond what you or your team can provide, it's okay to reach out for extra support. There are a number of ways you can obtain the help you need. Next slide. Locate community resources. For instance, your local agency on aging can help connect you to a variety of support services, such as home delivered meals, transportation, adult daycare, care management, and more. Your local agency on aging can also answer questions about which resources might be free and which may have a cost. You can also check into services offered in your community through the resources section in the Family Caregiving Guide. The Elder Care Locator is a public service of the U.S. Administration on Aging. It connects caregivers to local services and supports. Any of the resources I mentioned today are in the Family Caregiving Guide, and the Elder Care Locator can be found at eldercare.acl.gov. Next slide. A trained social worker or nurse can help you sort things out, determine what is needed, find services, and arrange care. And also, again, the Elder Care Locator is a great resource to find professionals should you need to get that type of help. I encourage you to highlight this resource. Next slide. Don't overlook the impact of caregiving on you and the person you're planning to care for. Pay attention to your health and well-being. The best way to ensure that you have the energy to care for someone is to take care of yourself. It's also the best way to help a caregiver care for you. Consider what you know you can and are able to do and volunteer to do just that. Know your limitations and do what is within those parameters. Some additional tips included tapping into resources such as social workers, nurses, and other professionals who can guide you through care options and help monitor the care that if you don't live nearby. Use of technology such as personal emergency response systems, remote monitoring devices, and mobile apps can help you coordinate care. Ask your employer. Some employers offer benefits or services to support family caregivers. To those who are still working, I encourage you to meet with your Human Resources and/or Americans with Disabilities Act representative, as they are a good source of information regarding benefits available to you. I spoke with our Americans with Disabilities Act representative when I became sick, and he told me a personal story that provided me so much insight into what I was about to go through, that really kind of lit the fire under me to get a team together and do it quick. Review finances. It's important to calculate your caregiving related expenses and account for them in your personal budget. Talk to your doctor. Let them know that you are a caregiver and discuss ways to manage stress. You should also consult with your loved one's doctor for training if you're expected to do complex medical tasks at home. Next slide. Take advantage of caregiving services and support. Services and support groups can help you throughout the caregiving journey. And take a break. Make time for exercise, sleep, healthy eating, and staying connected with friends. I was able to set up a situation for one of my daughters who at the time traveled from Massachusetts to Maryland, where I live, bi-weekly to help me out. I had to suspend my own gym membership, but I was able to arrange for her to be able to use my guest passes to go to the gym without me having to be present to sign her in. The gym created a special guest number for her, and she was able to de-stress and exercise while either the physical therapist or someone else was with me at home. Next slide. So we wrapped up the 5 steps of preparing to care, but this is just the beginning. AARP offers a variety of online information, resources, in-person events, and self-paced learning, all for caregivers. Now, I want to be sure to mention the 2 resources you see on the screen. First, the Caregiving Resource Center. This is a central hub for all things caregiving at AARP. There you can read the latest articles, get tips and advice, and that's where you'll also find the Family Caregiving Guide with downloadable checklists for when you need to update or revise your caregiving plan. In addition, there's the toll-free resource line you see here in English, and there's one in Spanish, and that number is 888-971-2013. There's also the AARP Learn at 50 Plus website. This is a site where you can learn about local in-person events, explore interactive educational videos, and webinars on caregiving. You can also download the AARP Family Caregiving Guide and checklist from this site. So again, that's aarp.org/learn@50+. Now, if there's any questions, comments, suggestions, tips, go ahead and place them into the Q&A.
And I do see one question that's already popped up, and that is, will recordings of these webinars be available to watch at another time? Yes, please make sure, particularly if you're talking about the rest of the Caregiving Series events, that please make sure that you register for them in advance, because they might not be available on YouTube or on our website, but we do make sure that everyone that has registered for the event gets a recording of it. We'll wait a couple more minutes, see if other questions pop up.
Yeah, I see a lot of yeses to the tasks people are already doing, taking
Yes.
care of others.
Yep, it's those things that a lot of people don't think of themselves as caregivers, but when you kind of lay it out for them and remind them that these things do count as giving care.
And I saw the name of one of my former caregivers up there, and so she knows full well what that was all about.
Well, as somebody that works closely with Teresa now, I want to thank the caregiver that is on here, because she's a wonderful lady. So
Yeah.
she said,
There she goes. Okay, so if only all of our family members was as agreeable to receive help as you are. I'm not saying I was all that agreeable, but I was given a rude awakening that this was something that I was not going to be able to handle on my own. And so, you know, I kind of hesitated for a while. And then after that ADA representative where I worked sat me down, that was my wake up call, like, oh my God, I need to do something. And then I kind of got into the situation too, where you know how you don't want to ask people in person, face to face, because you don't want them to feel on the spot, or you don't want to get that rejection. So that's when I kind of came up with the idea of just emailing. And that way it gave that person time to really consider and then see the chart and then kind of do their own thing. And that family caregiving guide that's on the website, it's actually, I mean, I wasn't aware of that at the time, but it's actually very much like that. And you're able to kind of, you know, make changes and updates. So any tips or revisions for caregiving to someone with dementia? Family does not include my mother in the process at all. I would do so, but I am not the boss at this juncture, considering having my mother here with me. That's a tough question. And you know, there are some specific groups that deal with people who have dementia, and I would say to try to reach out to some of them as well. There was one that gave an AARP presentation not too long ago. So I don't know if they may be listed on AARP's website. And it's hard. I mean, it's definitely difficult when family doesn't talk. But if your person is able to communicate at all, maybe, you know, try to find out if they're having a good day, what it is that they would like to do, and maybe go from there. But I always tell people, anything you do, as long as it's coming from a place of love and care, will be the right thing to do. And just try to get as much information as you can. So go to the AARP website and then look up, you know, maybe search under dementia, and this group may be there. And I don't know if you're even in Massachusetts or not, but I'm sure there are dementia groups throughout.
Yeah, I put in a plug and typed out an answer to check out the Alzheimer's Association.
Yeah,
They're absolutely the folks that can help with giving the appropriate resources for what you're specifically talking about. Um,
right.
I know it's easy to say on this side of things, but if you're part of that caregiving team, I think you got to find a way to voice that, even if you're not the boss. But I understand how complicated that can be, and maybe that's not the appropriate thing. So finding a way to maybe include some Alzheimer's Association resources or reaching out to them,
Yeah.
they have direct resources as well.
And I know a family also where the mother has dementia and she's in care. So she's in care near where one of them is. There's three siblings. One is in Virginia where the mother is. The other one is in Ohio, and the other one is in California. So the sibling in California does all the paperwork type stuff in emailing and paying of the bills. The one in Ohio takes time off once a month to go to Virginia to give the one who's there locally a break. And she goes and visits the mom and, helps her out and, it takes her for walks and things like that. So they all try to share as best they can and in doing the things that they're comfortable doing and that they're knowledgeable in, especially the one in California who's very computer savvy and all of that. And for them, it works. And it's not, they're never, the three of them are rarely in the same place at the same time, but they've been able to manage a way to come together to take care of their mother. And I always mention them in these presentations because I think it's so great that they were able to figure that out.
Yeah, caregiving takes place in a lot of different forms.
Yeah.
We don't have any questions in the Q&A right now. We do have a couple more minutes. If anything's popping up for you, please feel free. In the meantime, I did want to kind of circle back to one of the comments that someone made about, if only everyone was as willing to receive care. And I would say, Teresa, I don't know if you agree, but I think that is that is one of the top comments that we get giving this presentation, is that my loved one is giving pushback. They don't want to receive care. I don't know how to, convince them of that. So know that you're not alone.
Yes.
That is kind of a natural part of the process. And if anyone is going through that, I would just urge you to try to have patience with it. And I know sometimes it the energy rises and you just want to say, I'm just trying to help, I want to be there for you, but just trying to have as much patience as possible and just continuing to let them know that what you're doing is out of love. And Teresa said it during the presentation, but it's going to take time. That conversation will happen over time. And you just kind of have to
even
chip
if
away.
it doesn't, it does wind up working out. I have another friend who had to put her mom in care, who again had dementia, and it broke her heart because every time she went to visit her mother had her suitcase packed because she was ready to go. She was ready to leave, and it the first, I don't even know how long it took, but eventually, with the team that they had in the facility taking care of her, the mother kind of calmed down and got used to it, but it was not easy. Can you talk about the pros and cons of bringing services to them in their home versus moving them to assisted living? Oh my gosh. I mean, if someone is able to remain at home, that's awesome. I mean, all of us I want to be able to stay at home forever, as long as I can. And so, as long as it's not creating a hazard, if they're not, going out in the middle of the night by themselves or, leaving the stove on and things like that. Definitely. And AARP has another component that's called livable communities, where they're trying to encourage people to have this multi-generational type situation in their homes so that you can keep your loved one there with you. So yeah, my mother doesn't like to take her medications and would forget unless I stand over her. I have a special clock to remind her, which at times she will ignore because she doesn't feel like it. The doctors have spoken to her, but she's a very stubborn 94-year-old. Totally get that. And, these are things where maybe having someone else come in at the time she's, during one of the times she has to take the medication, just a friend, a neighbor, someone who knows her that she likes and trusts, that might be a way to help to help her to take her medication. If she's 94, you know what? She's done really great for a long time, and hopefully she'll still have a long time to go. So
Mm.
so
And I think that kind of speaks a little bit to the last question too. And I think sometimes it's a balance of, if someone is at home, right, it might be more labor and time consuming for you to have to take over some of these tasks, right? Like making sure they're taking their medications, making sure that the house is cared for and cleaned and things like that. And then if you move into an assisted living situation, there's also some of that, right? But there's a whole other cost factor involved as well. So one of the resources that you'll be receiving in a follow-up email today is called, and forgive me, I think it's the financial workbook, the AARP financial workbook, that goes over a lot of this. So in addition to the family caregiving guide, you'll also receive the financial workbook, which has a lot of phenomenal information. So please look out for that as well.
And also just make sure you check through whatever insurance they have, especially if they have a long-term care insurance, because a lot of long-term care insurance plans cover to have someone come in for an hour, or a couple times a week, or whatever the need is, and that cost would be paid for through the long-term care insurance. So definitely that should be one of the first things to do, is to check whatever policies that are already in place, and then kind of go from there as far as the person's ability to stay home, and if your home is able to accommodate having your loved one live with you. What I now, I'm here in Massachusetts with my daughter, who used to come down to Maryland all the time, and we have a situation. We bought a house together. I have one floor, she has the other floor, and so we each have our own living spaces. She goes to work every day, I get to do what I have to do, but for her, it makes her feel better that at least I'm not living by myself anymore, even though I'm quite independent, I have to say.
Well, thanks, Teresa. And I'm not seeing any other questions in the Q&A. So I do just want to wrap up by saying, if this topic is of interest to you, like I mentioned at the beginning of the presentation today, this is part of a caregiving series, a virtual webinar series that we're doing. This was actually one of the first presentations. So some of the other upcoming presentations we have are the caregiving costs, making sense of caregiving costs presentation, which is going to go over that financial workbook. We'll also be giving a presentation on downsizing and decluttering your home, as well as universal design features for a lifelong home. So I see a couple of thank you messages for you, Teresa, in the Q&A. And I just want to say to everyone present today, thank you so much for joining us. And please look out for that follow-up email. It will include a survey. So we would love to get your feedback so we can improve future events. So have a great evening, everyone.
Thanks, everybody. Take care.